All right, welcome back. Well, still talking about COVID-19. Yes, indeed, it's a global challenge everyone's facing. But now we're joined by Her Excellency Mary Beth Leonard, the U.S. Ambassador to Nigeria. Good morning, and thank you for joining us today.
Good morning, and it's my pleasure to be here.
All right, so tell us, how are you holding on? How are you hanging on? How are you coping with this period? It's unusual. Yes, indeed, you arrived in Nigeria not less than 7 months now, and this has hampered some of the actions you plan to take. So how are you adjusting to things?
7 months. Gosh, I thought it was 6. It's it's been an unusual time. I'm speaking to you from my home because, of course, we're all mostly teleworking, almost exclusively. And so I guess when you think about what you would be doing as ambassador of Nigeria, I guess I probably thought I would be seeing a lot more of Nigeria by now and a lot less of the walls inside my home. But we're all learning the things that you can do through the wonders of technology. This week alone, I've participated in a couple of chats with think tanks in Washington who are interested in Nigeria. I've spoken with American business interests who have involvement with Nigeria. I consult with my colleagues, and now I'm getting to talk to you good folks.
Okay, so that means the meetings have been going on, even though we don't know how long they will be going on for. Is that? How the companies...
Your sound is... Yeah, your sound is difficult to understand, but it's been an interesting time. One of the things that was great about my time here so far is I got to explore the Nigerian art scene a little bit. Actually, in my home here now, I'm here with 2 works of art by Nike Davies Okundai that I've borrowed here. I've also got art in my home from Nigerian American artists who work in the Washington area. So I did get to get out some, but I think we're all looking forward to the day when life gets a little more back to normal. But of course, we all know that needs to be something that's taken responsibly so that we're being as safe and as healthy as we possibly can.
Well, first of all, let me ask you this. So since you've been in Nigeria and all of the reactions, especially that's been going on as far as the fight against this pandemic is, from your experience working with the African Union and now working in Nigeria, what's your assessment of the move so far?
Of the moves, the mood or the move?
The move, all that African nations and Nigeria especially have been doing about this fight against COVID-19. What's your take?
Yeah, well, it's the entire world. I think every country is having its own sets of challenges in dealing with COVID-19, and it takes some time to work through. And I think that Nigeria is doing that as well. The United States is feeling very privileged to be able to accompany Nigeria in those efforts. We've got a really long history, about 20 years of really significant investments in the health sector, and some of those things are now paying off in the fight against COVID. The same sorts of laboratory networks and logistics ability to move samples, to move commodities, to do contact tracing that we applied to HIV, to polio, to tuberculosis, to malaria. We are now helping to transform into efforts against the COVID-19 epidemic. So I think it's been an evolving process in Nigeria, just like it has been in every other country. People learn, understand what it is that needs to be done, and fine-tune the response. The U.S. Embassy, the U.S. mission here, we have no fewer than 55 people, both Nigerians and Americans, mostly Nigerians, who are working hand in hand with their Nigerian counterparts. Most of these people, most of our Nigerian employees were trained here. They came from Nigerian universities and health institutions. Now they work for us, and they're back to working again with Nigerian counterparts on COVID-19, which I think is a really lovely story.
Just recently, President Buhari had a conversation with President Trump, and we understand that, of course, they were related to actions by your government to support Nigeria in this fight against COVID-19. When it comes to equipment, for example, we understand they're meant to be ventilators given to Nigeria. What can you say in that regard? What should we be expecting in the coming days?
Yeah, thanks for bringing that up. Yes, indeed, our two presidents got to speak together, and you'll recall that President Buhari was the very first African president that President Trump met. So I'm sure that they were very pleased to renew that contact. And first of all, there are two things. There's an ongoing effort of what the U.S. mission has been doing in Nigeria. Continent-wide, the U.S. government has spent $237 million specifically on COVID, and here in Nigeria, we're up to $32.8 million. And there's actually almost an equivalent volume of money that's still in the pipeline as we prioritize and figure out where we can have positive effect. The two presidents talked about the state of their own each's reactions to the pandemic, and yes, they spoke about equipment needs. And my understanding is I'm hearing on a regular basis from my colleagues in Washington that they're working through the logistics of that. So I don't have yet a timing or the specifics of what will be in that, but we expect to hear about that in the coming days. So whether in terms of programming through our USAID and CDC and Walter Reed Research Institute partners, or through the provision of equipment, we're really so pleased and so proud to be able to partner with Nigeria. This is a time when no country does this alone. Anywhere in the world, it's the nature of a virus, the nature of an epidemic. We're all in this together, and we need to work together.
When you look at how the U.S. is handling this, the U.S. has a huge, challenge on their hands trying to curb the spread in your country. And in the same vein, you see that you're trying to help other countries. And it begs the question, how is that even working out? Because honestly, people will say this is a time to look inwards and try to protect your own first. So what's the policy direction in that area?
Well, the United States has long been the international leader in health assistance. It's just something that we do. We have incredible relationships with other countries and their health systems, as we have here. In the last 20 years, all the assistance to Nigeria, U.S. assistance to Nigeria, is a little over $8 billion. More than $5 billion of that was in health. So international health assistance is just something that we do, and that's something that you're certainly going to keep on doing when you come to a historic pandemic like COVID-19. As I said before, the viruses don't understand borders. They don't understand lockdowns. They cross our globe, and so really there needs to remain that global response.
Talking about assistance, I saw a headline about USAID and how the U.S. assistance to Nigeria to fight COVID reaches $21.4 million. And in that, there's a section where you spoke about a humanitarian response, stopping the spread of the coronavirus. Is there any mention of research to develop vaccines in that figure? And is that figure accurate at the moment?
Yes, actually. We have, I believe, two... So these 55 people who are working on with the government of Nigeria, some of them are working on helping to transform our PEPFAR, the President's Program on AIDS Relief Laboratory Network, into testing for COVID response. We've got some people who are working on issues of communications and how you help people understand that pandemic. But we also have a couple of people working on research efforts. And I think that the U.S. is very open to comparing notes and having supporting different lines of research into whether it be a vaccine or which drugs work the best. I think there is a lot of experiential data that's coming up from the experiences that different countries are having in treating people and trying different sorts of treatments. It's funny that you mentioned, I think you mentioned the figure of 24.1 million or something of USAID assistance. This is evolving on a rolling basis. On the beginning of April, we put an op-ed that went in many Nigerian print publications about U.S. assistance, and back then it was $6.2 million, and now where we sit on whatever the date might be today, that would be the 13th of May, and we're up to 32.8. So we are consistently identifying more areas where we can partner, and everything from the activities I just mentioned to reaching out to individual states that we have relationships with, that we've worked in some of these other areas, and helping them to adjust those structures to their response to COVID-19.
bring up the issue about cure and vaccine. You may have heard conversation around, Nigeria trying to develop local cure for this, the conversation around that, the Madagascar cure, and of course for you, the remdesivir trials and the talk about how effective it can be in fighting this. Looking at all those options, what is your policy direction regarding a cure, especially in Nigeria, for example? Which one would you be going for Nigeria?
Oh, goodness. I'm neither a doctor nor an epidemiologist, so I don't think I'm going to handicap the race to a cure. I think it's going to probably take longer than any of us think. We all hope that by working as quickly as possible, we can reach that milestone. But meanwhile, our lives are what our lives are. And I think it's really important for people to, and something that you journalists have a really important role in, is to rely on good sources of information, to listen to the messages about the ways in which we need to conduct ourselves to stay safe. The idea of, if you need to be out and about, be wearing a face covering, distancing yourself from other people. I think it's really important to get the messages out about how individual people can empower themselves to help our entire community, our nation, our global community to be safe. There's a whole lot of activity that needs to happen on a technical basis to just identify people and take care of people. There's a whole big research effort to get to treatments and reliable cures. But meanwhile, I find the idea very empowering that although there's so much that is unknown about COVID-19, it's so new and it's scary and it's spreading and people are getting sick and some people are dying. But at the same time, we all hold the power in our hands through our comportment, making sure that we're not shaking hands, making sure that we're washing our hands on a regular basis, making sure that we're covering our faces when we're outdoors, avoiding large gatherings. It's what individual people do that will help contain this until we can get to that happy day when there's a reliable cure.
We're all looking forward to that happy day, definitely. But the reason I ask about the cure is, for a lot of people, they will say that they think the West looks down on, alternative, medicine, local cures. In fact, the Madagascar leader said that, the West looks down on our cure. I'd like to ask you, is that true?
I think any port in a storm. I think that, one never knows which is the line of effort that's going to be the one that comes up with the right answer. And you can't possibly ignore any of them. And so I think in a time of unprecedented, since the Spanish flu, in the time of incredible pandemic, the world doesn't have the luxury of dismissing anything. But those various lines of effort, need to be followed well, so that we make sure that people aren't experimenting because they hear that something is a good idea, but nobody has really tested that out yet. Obviously, one doesn't want to cause harm in between. But I think no avenue should be closed in these troubled times.
Any partnership, and tell us if there is, between the U.S. Center for Disease Control and Nigeria Center for Disease Control?
Oh, absolutely. Absolutely. They've been working hand in glove on so many things over the years. And now they're for example, some of the things that we've done for our, as the Nigeria CDC, for example, did case management protocols is to do peer reviews, fellow scientists talking to each other about, here, this is what I'm thinking about, and let's think together, put our heads together and think this is the great result. The idea of our PEPFAR labs that have the AIDS relief program, that those labs have become sort of the backbone of the laboratory network in Nigeria, has been in very close consultation with NCDC. They're a fabulous institution. We worked with them before, and we're certainly working hand in glove with them now as fellow scientists, as peer reviewers, as supporters.
Well, there is this material that we came across, and we just thought, well, since you're here, you might as well just help us shed light on this particular item, if you will. Now, President Trump signed this $2.2 trillion stimulus package. That's the HR 748, the CARES Act, that's the Coronavirus, AIDS, and Economic Security Act, in March 27, 2020. And this appears to be, of course, in response to the pandemic. But then the WHO did say that the case of pneumonia of an unknown cause was detected in China first, and it was first reported to them, I think, on December 31, 2019. But much later, it was then declared a public health emergency of international concern on January 30, 2020. But then it also shows that Congress, upon checks, will find out that there's this bill. This particular bill was introduced on the 24th of January 2019, a little over a year before all of this hit out there. So one wonders, what's going on? How come this is the case?
Part of your question was fuzzy coming through on my poor iPad, but I think that if I understand your question, it was it was to do with the timeline of the response and the timeline of people taking particular measures. I think the general answer to that question is that the lessons we are drawing of the importance of transparency in public health crises and the need to share information so that everyone can be as best prepared as possible. Individual countries' response, I heard you speaking about various pieces of legislation. Every country has a different road to hoe in terms of how to interpret management of COVID-19 for their own country. And just as the answer for Lagos is probably different for Borno. The answer for Italy is different than, Mexico. So I think every country needs to sort of puzzle through that. But one of the the fact that the disease has come in waves across the globe means that people who are farther down the pike, farther behind the curve, they haven't yet come into the worst of it, can try to draw some experience and lessons from what came before. So again, I think the message there is that transparency in public health matters is really, really important.
Okay, but part of the question also says that it turns out that the Congress actually debated this bill. It was first introduced in Congress a year, that's in 2019, before it was declared a pandemic. So is that a coincidence?
I think that was a separate discussion about economic stimulus. Of which there have been several in my country over the last year or so.
But just one last question here. Like the U.S., Nigeria also happens to play a leading role, some big brother role, if you like, in Africa and West Africa, and the rest of that. And partnerships are essentially supposed to be mutually beneficial. We know from some of the things that you have told us, the things that Nigeria stands to benefit from this partnership. Is there any specific thing that America is hoping to benefit from this mutual relationship between Nigeria and the U.S.?
First of all, yes, you're absolutely right. I've spoken a lot in the course of my time here that Nigeria sort of occupies the place in Africa that the United States occupies in the world. The big guy on the block and aggressively entrepreneurial and active and busy. And I think we have if countries have personalities, that maybe we have something in common with each other. I think that when you're talking about there are two aspects of this. When you're talking about scientific exchange, what plays out in each country can feed goodness and assistance in both directions. And I think also in terms of a region, a country, an important, significant country with the heft of Nigeria getting through this crisis successfully can only be good for the larger region and its future. I think we have to remember that we have a couple of sets of problems here. One is to deal with COVID-19, and the other is to think about the economic impact and where we're all going to be when we get to the other side and economies are able to truly reopen. And what will we all look like then? So there are a lot of important conversations to have, and a large economy like Nigeria, a political leader like Nigeria, has a lot to contribute.
All right, well, Nigeria is a great country, and you're going to love it here. So I hope you find time to enjoy some local, have some delicacies out there. They're very lovely ones, I tell you.
I'm looking forward to it.
All right, then. We do thank you for granting us your very first TV interview, as a matter of fact.
It is, absolutely. It's a pleasure to have had it with you. Thank you so much for having me on, and I hope everybody thinks really hard about how the way they personally act can help contain this virus. And we're all in this together, and we'll all get through it together.
Yes, indeed, we will. Thank you very much indeed, Her Excellency Mary Beth Leonard, the U.S. Ambassador to Nigeria. Well, back in a moment. Stay with us.